Welcome, my name is Sabine and I'm an exercise physiologist with TMC's Cardiac Rehab program. My video today will focus on shoulder range of motion and getting the muscles of the chest and the upper back a little more attention and a little bit more lengthened. This really applies to anybody. If you think about the average person, they spend at least several hours a day seated with their shoulders internally rotated, which is not good for breathing mechanics, blood flow, as well as just the length of these tissues. So it applies to the average person in your life, but also our special cardiac population who may have had open heart surgery. This sternal area often gets a beating, and we really need to work on mobilizing these tissues, getting the connective tissue and the muscle to open up again. So today's video is going to focus on that, and hopefully no matter where you are in life, you'll find some use out of this. So we're going to start by just giving ourselves some hugs. It's not a bad thing at all, right? I want you to try to reach behind you, touch your shoulder blades. This may be difficult for you if you don't have a lot of range of motion to begin with, but I want you to try. And you're going to open up. I want you to contract those muscles between your shoulder blades, your rhomboids, and do it again. So hugging, try to inhale here, exhale, and squeeze, wrap around. Maybe switch arms if you can. Inhale, remember the breathing's always part of this. You want to be using your lungs and the muscles of breathing around the rib cage. Inhale, exhale. I'm going to turn around so you can see what my back is doing. So engage, squeeze those shoulder blades together, and stretch. We want to lengthen these. One more time. All right, good. Hopefully you're starting to feel a little more warmed up already. All right, so let's do some scapular range of motion. So the scapula is the shoulder blade, okay? I want you to elevate your shoulders up, bring them forward, down, and back. So I'll turn around in a few seconds, but I just want to show you from this frontal view, and then I'll switch so you can see the other side. And I really don't want you to rush through this. A lot of the time when I see people stretching, they just rush through it as if they're just lifting weights, and that is not how you're going to feel things properly, all right? So turning around now, you want to really feel these two scapula floating nice and slow so you can feel all those different positions. And if you've never done this before, it might feel kind of strange because you're not used to isolating this joint. Let's go the other direction. This is also a great way to relieve some tension in the upper trapezius, these tight upper back muscles that tend to accumulate a lot of tension throughout the day. All right, so make sure you do a few of those both directions. Now we're going to focus on the actual shoulder joint itself with the humerus, the upper arm. So I want you to try to keep your rib cage aligned. I'm going to show you what my feet are doing real quick. A lot of people forget about what the lower body should be doing here, but what I don't want you to do, and I'll show you from both sides, when you're doing these upper body postures, I don't want you to get into this like hyper extended lower back position. All right, so pull your navel in. You want your core engaged, nice wide base of support, feet about hip width, maybe a little bit more, so that this is nice and solid. This is your base of support, and then you can do all the upper body movements with good mechanics. All right, so I want you to take, I'm going to mirror. So take your right arm. All right, I want you to keep the elbow mostly straight and try to sweep it across your body. Try to not rotate just yet. Just move only the arm, bring it across your face. And here's the part where most people rotate. Instead of doing this, I want you to try to keep all this stuff facing forward, just the arm rotating. It might hurt a little bit. Go nice and slow. You might hear some snap, crackle, pop. That's normal. Let's do it again. Sweeping the arm across. You might be feeling some stuff mobilized that you haven't felt in years, and I think that's a good thing. All right, let's do one more time, and then we'll go the other direction. And hopefully you'll notice that it starts to glide a little bit more. We're getting that synovial fluid to move. All right, let's go the other direction. So starting behind, don't rotate. Keep your ribs facing forward, up, around, and coming in front. If you want a little bit more of a challenge, you can make a fist or even hold a tennis ball, and you should feel this stretching out things even more. So I'll do one more, and then I'll do the other arm. And this is actually the warm-up that I use before I weight lift because I want the muscles of my shoulder girdle to not start cold. So this is actually very multi-purpose. All right, other arm sweeping across. And your elbow might bend a little bit, but do your best to keep it mostly straight, coming across the face. Here's where you really have to focus on rotating, pulling it back, arm as straight as possible. If you have a shoulder injury, I'm sure that that arm will perform differently, but you can think of this as some rehab for it, right? You got to start with whatever mobility you have and build from there. One more circle, then we'll go the other direction. And just so you know, I'm hearing all kinds of stuff happening in here. So even if you're healthy, you're going to hear a lot of noises in that joint space that don't happen most of the time unless you're really trying to maximize what this can do. Okay, one more time, sweeping it back, rotating, feeling that movement happen deep in the joint and come forward. Good. All right, so just notice how you feel. Maybe you want to shake things out. You can, loosen things up a bit and compare this to how you felt when you started this video or started this routine. All right, so we're going to do a little bit more. I have one prop. I have one more stretch that I want to do before we use that stretch out strap. So I'm going to face this way. I call this rotating scissors, and it's a really great way to wake up the muscles of the trunk. So the back muscles, the core muscles, the breathing muscles, and also the shoulder. So it's a very integrated movement. Nice base of support. Pull your core muscles in, slight tuck of the tailbone. Nothing exaggerated. You just want a neutral pelvis. I want you to lift your arms up. Big inhale. Keeping your hips pointed forward, I want you to rotate the rib cage. Try to keep the arms straight. All right. This is the scissoring. Come back up. Rotate the other way. And I want you to try to notice where you're feeling these sensations. You might feel it deep along the spine, between the shoulder blades, maybe in your core, all kinds of areas. And believe it or not, this is kind of aerobic, so don't forget to breathe. Inhale, exhale. Inhale, exhale. I'm going to face the other way so you can see. All right. This feels really good. I love doing this in the morning to just get the lymph and the blood flowing. I'm actually getting pretty warm doing this. So if you're falling asleep in the middle of your workday, just try this. All right, one more. Okay, you should be nice and warm at this point. So pretty much everything that we've done is without props. I'm going to use one prop, which I think is very effective. This particular one is called an OPTP, that's the brand, stretch out strap. So it's a physical therapy tool. You might have a yoga strap. Anything will help. I prefer to have loops. So if you have a strap that doesn't have loops, it's still going to work. But if you can find this, they're not very expensive. It's really great for putting the hands in or even the feet. So just for your own education on this, you can do a lot with these straps. So I'm going to do with this spacing about 4 loops. Actually, I'll try 5. So I'll show you what 2 spaced out would be. So if you have the strap like this, you are not going to be getting a very good stretch because it's just not an optimized length. It's just going to be flaccid. So we don't want it too lengthened. We also don't want it too close. So if I have it too narrow, then I won't be able to really get that range of motion. So you need to find that sweet spot in the middle. And that's different for everybody's wingspan. So right now I have about 5 loops. So my hand's in one, counting each loop to the other is 5. Let's try what I call a W stretch. If you've done Pilates, then you might recognize some of this. All right, so nice base of support. I want you to sweep this up as high as you can. Now, if you have some type of rotator cuff injury, it's possible that you're not going to get this far back. You might be right over the head. You might even be in front, but we just have to start with whatever that starting point is. So don't feel discouraged if you're like, my shoulder just won't let me go back further. With time, you will gain some of that range of motion. All right, I want you to sweep it up as high as you can, and I want you to do a W stretch. Watching yourself in the mirror is ideal. I want you to bend those elbows symmetrically and see if you can feel a stretch across your chest. This is your pec major. Pressing up, and down. So you should feel your chest stretching and your muscles, the rhomboid muscles between the shoulder blades, engaging a little bit. So just see where you're at with this. All right, find that passive range. Good. Now we're going to do a little bit of work. Make this spacing a little narrower. All right, and I want you to roll your shoulder blades down and back, anchor them. All right, your palms are facing down here. Remember, keep your core in. You don't want to be sticking your butt out and compressing your lumbar vertebrae. All right, so nice neutral pelvis. I want you to isometrically push apart. Now, if you feel any lightheadedness from this, take it easy. All right, this isometric work actually can be pretty difficult. So take some deep breaths. You want to stay oxygenated. All right, ready, set. I want you to oppositionally push apart. So I'm pushing this arm this way and the other that way. So it's a tug of war. I'm pushing and I'm basically feeling my back broaden. So turning around, I'm pushing out. So it's almost like I want my shoulder blades to get further apart from each other. All right, so I'm holding that. I'm not holding my breath, I'm holding the posture, but I'm still breathing. So I'm going to hold this for about 10 seconds. Hold it for less if you have to, and then relax the muscle. I'm going to sweep my arms up to about navel height. Big inhale. Exhale, I want you to push apart. So keep the shoulders and the upper back relaxed, but the arms are really pressing away from each other. So concentrate on feeling those muscles right at the base of your shoulder blades. 3, 2, 1, relax. I'm actually sweating, believe it or not. Go up a little higher, maybe a little lower than shoulder level. Big inhale, right hand, push apart, keep the elbows relaxed. You might be shaking, that's totally normal. 3, 2, 1, and relax. Awesome. Okay, let's go through 2 more hand positions. We're almost done with the hard part. Thumbs pointing up, all right? So my palms are facing each other. Starting down here, big inhale, and ready, set, push apart. I'm gonna turn around so you can see what my back's doing again. So my shoulder blades aren't pinching, they're actually broadening apart. 3, 2, 1, relax. Take as many breaths as you need. Sweep that strap up to about navel, belly button height, ready, set, and push. Keep those shoulder blades down, away from the ears. If you're doing this properly, you will feel this perhaps tomorrow as well. 3, 2, 1, and easy. Good. That last arm position, a little bit higher, ready, set, and push apart. So I'm trying to, again, bring those hands away from each other. I'm not going to break the strap, okay? So this is where they stay, but I'm definitely pushing oppositionally. And relax. Okay, last one here. So I'm going to keep this hand position, palms facing each other. I'm going to keep that tension, but I'm actually going to sweep this up, pushing the whole time. I want you to try about 5 of these. All right, so again, pushing apart, constant tension, and I'm going to sweep my arms up as high as I can, still pushing, still pushing, still pushing apart, still pushing on the way down. Let's do a few more. You probably never felt these muscles activate in this way before. Pushing, pushing, pushing. Let's do one more. So none of this is passive. All right, hard part's over. Widen your grip, just one more loop or a few more inches, depending on the type of strap that you have. I want you to sweep this up and let's see where your range of motion is at now. Try to do that W stretch again. And I bet it feels a little bit looser. You can bring it down, sweep it up. Elbows bending symmetrically. Just try a few more, and I bet this is a lot less challenging than it was in the beginning before we really got these muscles engaging. Last one. All right, so we will finish with that. If you want to just check your mobility again, you could try that arm sweep and see how much more fluid it feels at this point. I bet that it's a little bit easier to glide that joint around. So I'll finish with that. Hopefully this gave you some ideas for ways you can break up your workday, get a little bit more mobility in your chest and your back, and overall improve your posture, because a lot of the way that you carry your upper body affects the way you breathe and the way you walk around. So thanks for watching, and please forward this to your friends that might